If you are over 60, changes in your urine or swelling in your legs may be dangerous.
These symptoms are often more than just a sign of getting older. They signal kidney trouble. I am Dr. Eleanor Hart, and today I want to discuss your kidney health with you. Kidney disease is a silent threat that many older adults ignore until it is far too late. Let me tell you about a patient named Margaret who initially ignored the warning signs.
Margaret thought her body was just slowing down due to her age, but she was wrong. Her shoes felt tighter, she was more tired, and she was waking up frequently. It is probably just age, honey. Do not worry about me too much today.
As a doctor, I have heard that sentence far too many times from my patients. Because after 60, kidney problems do not always arrive with a dramatic or painful warning. Sometimes they whisper first, giving small clues that most people choose to ignore entirely.
Stay with me. One of these signs is brushed off every single day by seniors.
Sign number 1, swelling in the feet, ankles, or the lower legs.
When the kidneys fail to handle fluid well, the body starts to hold on to extra water. That extra fluid shows up in the extremities, often appearing as persistent swelling.
Some swelling has harmless causes, but persistent swelling always deserves your full attention, especially if it is new, worsening, or comes with a shortness of breath. Sign number 2, changes in how often you find yourself needing to urinate.
Some people begin urinating much more often, especially during the middle of the night.
Others notice they are going less than usual, which is also a major concern.
Not every bathroom change means kidney trouble, but a real change in pattern matters.
The body is often giving clues long before people actually want to listen. Sign number 3, foamy, dark, or unusual looking urine that you might notice.
This is one of the most overlooked signs that people ignore every day.
Foamy urine may suggest protein loss, which is a key sign of dysfunction.
Dark urine may point to dehydration or something else that needs a review.
A one-time change may mean very little, but a repeated change is different. Repeated changes in your urine always deserve your full and immediate attention. Sign number 4, feeling unusually tired, weak, or drained of all energy.
Kidney problems can sometimes leave people feeling worn down in a deep way.
This is not normal tired. It is not, I stayed up late tired.
Some people describe it as having absolutely no gas left in the tank.
That matters, because fatigue after 60
should not always be blamed on aging.
Sign number 5, puffiness around the eyes, especially noticed in the morning.
Things. This can happen for many reasons, like poor sleep or seasonal allergies.
But when morning puffiness keeps showing up with other signs, take notice. One sign alone may not tell much. A cluster of signs tells more. Let me say this clearly. The biggest mistake adults make is waiting for pain. Vertebrae.
Kidney problems do not always cause physical pain in the early stages.
That is why people miss it. They keep waiting for something dramatic.
Meanwhile, the body keeps talking, even if the message is a whisper.
Sign number 6, persistent itching, dry skin, or sudden muscle cramps.
When the body is not balancing fluids well, the skin and muscles notice.
Muscle cramps at night can be a sign of mineral imbalances in the body.
And insulin. Now, dry skin alone does not automatically mean you have kidney trouble.
They're derived during growth spinins. But dry skin plus other warning signs should never be ignored. Sign number 7, poor appetite, nausea, or a strange metallic taste.
Pocklightins. Some people say food suddenly tastes off, or like metal in their mouth.
Others feel mildly nauseated, or simply just stop wanting to eat at all.
Again, this sign is not specific by itself, but the combination matters. When appetite changes show up with swelling and fatigue, seek a review. It's a little brave. So what should you do if this sounds familiar to you? First, notice patterns. Look at swelling, urine, energy, and your appetite.
Second, keep a short record of your symptoms for a few days.
Note when the swelling started and how often you are getting up.
Third, do not neglect the basics. Stay hydrated unless told otherwise.
Be careful with heavy salt intake and bring your medication list.
And never stop prescribed medication on your own because of suspicion. That is not smart. That decision needs a real medical review. Now let me give you the urgent red flag warning today.
Seek urgent medical care right away if you notice blood in urine.
Severe shortness of breath, chest pain, or very little urine output.
Do not sit at home and rationalize those serious symptoms away.
If you are barely urinating, that needs prompt and professional attention.
When Margaret finally came in, she did not have just one clue.
She had several: swelling, foamy urine, fatigue, and high blood pressure.
Her blood pressure had quietly become much harder to control recently.
She was lucky she came in when she did, before it worsened.
Not everyone waits and gets away with it. Prevention is key.
If you are over 60, kidney trouble is not always loud. Sometimes it shows up as changes you could easily dismiss today. And if longer, that is exactly why you should not dismiss them at all.
Tell me in the comments, which sign do people ignore the most?
Subscribe to Oakwell for clear, practical senior health advice without nonsense.
Because after 60, the small sign you ignore can be dangerous.
It can become the bigger problem you never saw coming soon.
तू साथ पर गए बंदली पे नीमू कर दम बांधा